with a mask. That's when I went up there on day 5. I didn't care what they said. So Janie and I both went up there, my wife.
And at this point, they're saying flu, not COVID.
Right. Okay. Yeah, there was no COVID in Texas. There was only in China at this moment. So we were okay. We were free to go in and out as a family. There was no issues surrounding COVID at this point. That night, though, while I was there, I noticed that his abdomen, he was very thin. Mm-hmm. His abdomen had at least 10 to 15 pounds of water in it. You could touch it, and it actually bounced up and down like a waterbed. Remember, he was going in and out of consciousness, so he was coming in and out of it and delirious at this point. And I waited around. I asked the nurse station when was the next time the next attending doctor was going to show up, or medical doctor. They told me 9 o'clock in the morning, so we were there at 8 in the morning. By the time I got there at 8 in the morning, on the 6th day, his abdomen was another 10 pounds heavier.
Wow.
With water, and his breathing was even more labored. So by the time the doctor showed up at 9 a.m., as soon as the door opened, it hit me, and he was surprised to see somebody in the room. And he said, "Hi, I'm Dr. So-and-so," and I said, "Hi, I'm Dr. Artis. I need you to show me his records from the first time he walked in here." Mm-hmm. So we walked over to a computer screen. I asked him to show me the pathology report, all of the testing they had done on day 1 to determine what type of infection he had. Mm-hmm. And as they went down the list of all viruses, bacteria, and fungi they had tested for, to the doctor's surprise, each of them were flagged negative. So influenza A was negative, influenza B was negative, bacterial and viral pneumonia were negative. And so I looked at him and I said, "Why did you diagnose him with the flu then if he didn't test positive for the flu?" And he looked at me and he said, we assumed it must have been a false negative.
Assumed it.
Assumed it. And I said, "My problem is this. Even if you thought it was the flu or you got a positive test for the flu, antibiotics don't treat the flu. Why do you have him on that bag of vancomycin, which is an antibiotic? It was hanging up on an IV bag, drip." And he said, and I said, "How long have you been giving that to him?" And they said, "We've been giving it to him since day 1. Mm. And then he goes on to tell me that that's not only the only antibiotic, he's on 2 other ones also. We put him on 3 on day 1. And I said, "Why would you do that? The antibiotics don't treat the flu." And his response was, "That's just hospital protocol." And I said, "You have to get him off that vancomycin right now. You know that drug, that one, causes acute kidney failure, and you called us 3 days ago to tell us he's now gone into acute kidney failure." I said, "In fact, I don't even think he has pneumonia. I want you to show me his x-rays on day 2 when you say he tested positive for pneumonia." Mm-hmm. So they pulled up the chest x-rays, and I was looking at him, and he points and he goes, "There's the pneumonia right there on day 2. And I said, "Where's pneumonia?" Mm-hmm. And he goes, "It's right there." And he was looking at this very defined white line in the lower lobe of his left lung. And I said, "That's not what pneumonia looks like. Pneumonia looks like cauliflower appearances on a x-ray." Mm-hmm. I said, "That is a straight line of water, complete solid, same opacity or shadowing." And I said, "That's pulmonary edema. Mm-hmm. That's water filling up the lungs because you've caused acute kidney failure with vancomycin. And you've continued to do this over time." So there was an incorrect diagnosis of pneumonia. He also had shown me that on day 1, there was no positive test shown for bacterial or viral pneumonia, but the next day he had it. Mm-hmm. But he also didn't test for the flu. So now I've got 2 ill-advised issues. Pneumonia was not positive. I asked him to do a sputum test to determine if it is viral or bacterial pneumonia on day 6. Mm-hmm. He said, "No, we will not do that. That is not hospital protocol." I said, "You cannot definitively define that that's pneumonia versus pulmonary edema without the test.
Right.
It's just a screening test when you're looking at x-rays." So anyway, I told this guy to get him off vancomycin, which was causing acute kidney failure. What had really happened, and I told him, I said, "You've done chest x-rays since day 2 till now, and the water levels have gone up in his lungs. Day 5, now you're saying he's going in and out of consciousness. That means water's now getting on his brain or around his heart, and it's depleting oxygen levels to his brain." I said, "You are drowning him to death, and you better get him off that vancomycin." And he said, "Okay, well, we'll go talk to the other docs and the administrators to see if we can do that." And I said, "No, you're going to get him off that right now. It's not warranted against viral infections or diagnosis." And then I said, "When's the last time you put him on Lasix?" Because he had retained a lot more water from the night before. Mm-hmm. And he said, "Oh, we've been giving him Lasix every day." And Lasix, for anybody watching, is a pharmaceutical diuretic. It makes the kidneys excrete water. And remember, he's now in acute kidney failure, they told me. So he said, "We've had him on Lasix this whole time, every day." I said, "Show me the medication schedule." This is in front of my wife, in front of my unconscious father-in-law. "Show me the medication schedule." He pulls up day 1, no Lasix. He goes, "Huh." Day 2, no Lasix. "Huh." Day 3, 1 dose of 20 milligrams. Day 4, none. And he's like, day 5, none. And I said, "He at least has 10 more pounds of water in his abdomen right now than he did last night. You better get Lasix right now and put him on it." Now, this is the attending medical doctor, and I'm expecting they are attending to his care.
Right.
He's obviously unaware of multiple issues right now that's causing complications in him. So they go out to the nurse's station, bring in actual Lasix administered to him for 4 hours. He loses 20 pounds of water weight in 4 hours.
Wow.
About an hour after the 4-hour treatment, the respiratory therapist who has this mask on, forcing air and oxygen into his lungs because he can't breathe, his lungs are filling up with water from pulmonary edema for days. The respiratory therapist comes in and is listening with a stethoscope at all the lung fields, and he says out loud to the entire family, "This is the first day in 5 days he hasn't had a crackle, no gurgling sounds in his lungs. His lungs sound completely clear." So he says, "We're going to turn off the forced air into the mask. I think he can breathe on his own. Let's just see if he can keep his breathing rate up and his saturation of oxygen level up." And he did, all on his own for the next 5 hours. And we go home, only to find out at 9 o'clock that night, the nurse's station called my wife to tell her that the hospital administrators and the attending doctors had a meeting and told the nurse's station to cancel all future Lasix treatment.
Why?
They were claiming the Lasix was going to be damaging to his kidneys and cause more kidney failure, when in reality it improved all of his breathing over just a few hours. They told us that he was no longer going to be on Lasix, and that was really upsetting. The next morning I went up there, his water retention had gone up. They put him back on forced air, and then they, as a result of my getting in their faces demanding different protocols, they had me escorted out of the hospital, convinced my wife's family that over the next 3 days, it's time to let him go and just put him on a morphine drip, and let's remove his pain and let him die. And it was, to me, an attempt to cover up all of the things I was disclosing and that they were finding were going to work to actually bring him back to life. They had to actually convince my wife's family, who didn't know as much as I knew from clinical practice over 20 years, how the body heals and how it functions. I actually think the liability to the hospital administrators was more of a threat, that if I sued them for actually causing acute kidney failure and making him go in and out of consciousness over a few days, I think that was more scary to them than actually trying to then tell me, because I'm married into the family, and told my wife's family, we're not talking to him anymore because he's married into the family, we're going to have him kicked out of the hospital. And we're only going to talk to you. And the rest of my wife's family said, we don't know healthcare, so we're just going to have to rely on the medical professionals. So it was, I believe, their attempt to cover up, get me out of the way, and then actually continue the protocols as they were. And overall, over a 9-day period, I haven't even looked at the cost of those treatment protocols over a 9-day period, but hundreds of thousands of dollars would have been billed to Medicare. For the next 2 months, I actually didn't leave the house. I didn't talk to anybody. I was so furious that they would actually go to these lengths and not take their Hippocratic oath seriously to do no harm. I would assume that if I actually gave you information and you applied it against your hospital protocols and it made improvements, that would make you excited as someone who's actually in the field to try to improve the life and health of other people. And that was not what I found in relationship to my family and my father-in-law particularly. So 2.5 months go by. I'm just furious and angry and depressed. And this is why I got into the COVID thing. So why I ever went into the media from the beginning. In the middle of May, an alert came up on my phone that said, today marks the day in history where the United States of America had more deaths in one day from COVID-19 than any other countries had in one singular day during this pandemic. And I was just sitting there and I remember thinking, we live in America with the supposedly greatest U.S. healthcare system in the world. Why would we be struggling to keep people alive worse than any other country? So I decided to find out, what are they treating COVID-19 patients with? Because I had not paid attention to the pandemic at all, even though it had reached into Texas towards the end of February and early March. So what I found was I went to CNN and I wanted to know, what are they reporting in New York? Because in New York is where there was a huge outbreak initially with COVID-19. And what the hospital administrators and the medical doctors were stating in the news was, in their press conferences, was this, verbatim: we are finding that within 3 days to 5 days of treating COVID-19 patients, we are finding that we have never seen a complication like this before, especially with a respiratory virus like COVID-19. When we start treating this respiratory virus, within 3 to 5 days, we're seeing severe acute kidney failure in all of our patients. So severe, in fact, that we don't not only have a shortage of ventilators to help patients breathe through COVID-19 treatments, we're experiencing shortages of dialysis machines to handle the acute kidney failure. Now, what got my attention was, one, the medical doctors were being very honest when they were saying, we've never seen a respiratory virus, which is what they were saying, we've never seen a respiratory virus attack the kidneys like this and cause acute kidney failure. That was the first thing. And the truth is, still to this day, they're being very honest about that. Respiratory viruses don't attack kidneys. So they were not used to seeing this. This was them absolutely being ethical and honest. Mm-hmm. The next statement was, we're seeing acute kidney failure in 3 to 5 days after we start treatment. Mm-hmm. We've never seen this before. And this is what got my attention, because my father-in-law 3 months earlier, we were called on day 3 of a viral diagnosis that he was now in acute kidney failure. And it was not caused by a virus. It was caused by an antibiotic called vancomycin. Mm-hmm. So I wanted to know, what are they doing with these patients in New York? What's the treatment protocol? So, because I didn't know, I actually thought, I bet they're using vancomycin, like they did with my father-in-law. Only to find out that wasn't the case. Okay. It was something much worse. So I go to CDC.gov's website on that day, it's like March 14th or May 14th, 2020. I'll look up CDC.gov's mandated protocol for treatment of COVID patients in hospitals. Mm-hmm. And it says, we have adopted the NIH's mandate, the National Institutes of Health's mandate for COVID-19 patients. Hyperlink here. Click, took me to the NIH.gov's website, and it took me to the page where Anthony Fauci was declaring the mandated treatment for COVID-19. This is in mid-May 2020. And what it states is this. It says, during this COVID-19 pandemic, all serious COVID-19 patients treated in hospitals are going to be treated with one drug and one drug only. That one drug is called remdesivir. Remdesivir, there's 2, this is an experimental drug, but there are 2 studies that support its use during this novel coronavirus pandemic.
And when was this about?
This was in May, I was looking at this, May 14th, 2020.
So just on a timeline, you're talking about, there's no vaccine program yet. This is the treatment protocol. People are coming into hospitals. And that was it was a single targeted treatment. They
one single targeted drug.
Yep. Okay.
Yeah, so what he stated was, there's only one drug you're going to be treating in hospitals across the nation. Only one, and that's called remdesivir. This is an experimental antiviral drug, which meant it wasn't FDA approved ever, which was the first problem. Then he stated there were 2 studies, one against the Ebola virus from 2018 and 19, that proved it safe and effective, remdesivir, against the Ebola virus. And because of that study, it warrants its use in this new virus called the coronavirus, or SARS-CoV-2 virus. He was quoting this Ebola study, saying it was found safe and effective against Ebola virus, so we're going to use it during this virus, or against this virus.
Is this written on the NIH's site?
Yes, this is on NIH's website. This is where I'm reading it, on NIH.gov's website.
Okay.
So I'm reading this, and then he says there's a second study that also supports its use. It says there's a cohort study that was conducted by Gilead Sciences, who is the maker and patent owner of remdesivir. Okay. And so I'm just reading this, and then it goes on to bash two drugs. In the same article, it says you are not to use hydroxychloroquine against COVID-19. It's proven to cause heart failure in COVID-19 patients. And I remember thinking, that's weird. That drug I've known about for 70 years has been FDA approved. And then it says, and you're also not going to use chloroquine. So now that we know these two drugs, I'm now learning, have been found dangerous to COVID-19 patients, I want to know what's so miraculous they found about remdesivir in the Ebola trial and the cohort study by Gilead. So the Gilead study, just for reference, was conducted and concluded in March of 2020.
Right before this, wow, okay.
2 months before this declaration, okay? The Ebola study was final in August of 2019, which was just less than a year, like 10 months earlier, okay? So I click both of these studies to go find out just how miraculous was this remdesivir study. I want to know, what did they find? And I just want you to know, everybody needs to know, I'm not making any of this up. This is the actual printed New England Journal of Medicine Ebola virus remdesivir trial that Anthony Fauci was quoting. So I actually just opened it, I clicked the hyperlink on NIH.gov, went through this entire study, only to be blown away. I could not believe it, what I was reading. This study was conducted in 4 regions of Africa from November 2018 through August 2019, and they gave it to multiple people throughout those regions. They gave 4 different experimental drugs in this trial, only 4. It was remdesivir, a drug called ZMapp, which was actually put into the study and funded by the United States Department of Health and Human Services. They put ZMapp in there. And then DARPA, our own defense contract group, decided to put in another drug called a singular monoclonal antibody. And then Regeneron was the other 4th triple monoclonal antibody experimental drug put in the trial. So there's 4 drugs in the trial. Remdesivir, ZMapp from the United States Department of Health and Human Services. Number 3 was a monoclonal antibody put in by DARPA, our own government. And then the 4th drug is called Regeneron, which is made by Regeneron Pharmaceuticals, a monoclonal antibody. So I'm reading this whole study. It goes on from November 2018 to August 2019. There is one review board who's assigned to review the entire safety and efficacy of this trial. That's the National Institutes of Health. That's who supported and funded the whole trial. Okay. But they had to allocate a third-party independent safety board to also review the data. Come August 2019, they did a review of all the data and found out that there were 2 drugs of the 4 that were found to be the deadliest and most complicating for organs of all the African Ebola virus patients. They found that remdesivir killed 54% of all people they gave it to within 28 days. They found...
And they're saying, there's 2 things. One saying within 28 days, this many 50-some-odd% died, but were they giving attribution saying that it was the drug that caused the death?
Yep, so they actually gave attribution to these drugs being too toxic and dangerous.
Wow.
So they were looking at mortality rates of all 4 of these experimental drugs. Remember, none of these are FDA approved, never been used or found safe before.
Well, they had to stop the trial then. I mean,
So they pulled remdesivir from the trial 6 months in and said, we're no longer giving this drug out to people. It's killed 54% of people we gave it to.
Wow.
ZMapp, which was put in by our own Department of Health and Human Services, that drug killed 49% of everybody they gave it to. So the safety board pulled those 2 drugs and said, no one else in Africa can be given these drugs for Ebola. Now, my problem initially was, Anthony Fauci, you funded this entire study. You would have been given all of this information in 2019. Why would you pick the one drug that didn't even make it to the end of the trial and was found to be the most deadly or dangerous?
And this is the specific study that he's citing as to for his rationale in doing it. But how did it clear FDA then? I mean, there's no way FDA could clear this if
That's right.
54% of people are dying from it.
Yeah, so this was May 2020. This is the reason for these conclusions of that Ebola study in 2019 is why it was never FDA approved anyway. So even at this point, it wasn't FDA approved. They put in an emergency use authorization to use the drug.
And they were granted it based on this data?
No, based on Anthony Fauci's recommendation and the cohort study from Gilead. So going back to the Ebola study, which I think is amazing, because right now you're hearing about monoclonal antibodies as a treatment for COVID-19. Right now we're in, what month? September 2021. And now they're saying, in some states, like in Florida, they're saying we should do early treatment with these monoclonal antibodies called Regeneron. Well, Regeneron was the actual drug in the trial that had the lowest mortality rate. Its mortality rate was 33% of everybody they gave it to, which to me is not that impressive. But in comparison to ZMapp and remdesivir, it is better. But it's not so much better. I think you should be giving it to everybody.
Well, I mean, you're basically saying a third of the people who get the drug are going to die.
Yes, and that's what they found inside the trial. So they took these 4 experimental drugs, they excluded 2 that were the most deadly, which was remdesivir and ZMapp, and the singular monoclonal antibody that was provided by our Department of Health and Human Services, and then Regeneron were the 2 that were found to be the most successful because they had 10 and 15% less mortality rate than the other 2 drugs. They were only comparing the 4 drugs together, so they picked the 2 that were the least deadly. Why would Anthony Fauci, immediately when I read this, my problem was, why would you pick that drug that you knew was the most deadly in your own funded trial from a year earlier? Why didn't you pick Regeneron, which only killed 33% of all people you gave it to? Why didn't you pick the monoclonal antibody that only killed 35% of everybody you gave it to? Why didn't you pick the Department of Health and Human Services ZMapp drug that only killed 49.1% of all people? Why did you pick the one that killed 54% of all people that gave it to? This made no sense to me unless you were just pure evil.
Well, none of it makes any sense, right? I mean,
endanger people.
the death rates of any of those drugs would be completely unacceptable.
All of them are absurd.
I mean, a 1% death rate would be unacceptable, let alone what you're talking about. So I don't know how they made it through. So do you have an answer to that question?
No, I just think there must have been some intentional decision to actually harm as many people as possible.
Well, you said there was a second trial by Gilead. Where'd that show?
Yep. So Gilead, I have that trial. I have that whole trial right here. It's marvelous, and I want to read some of this to you.
Okay.
So here it is. This is the Gilead remdesivir trial in March 2020.
I just want to highlight something you said so it doesn't go by. There's a conflict of interest in essence because the trial is performed by the pharmaceutical manufacturer who makes it. So there could be a bias in there. It's not like a neutral party is taking an objective look at this. It's basically the person who profits from the drug is doing the study to say that the drug is validated. So with that as the backdrop, what do you have in the